Welcome everyone to the Healthcare Reporters MEDSIS training, specifically for overdose and neonatal abstinence syndrome reporting. Today we're going to go over a little bit of background surrounding the emergency declaration, MEDSIS access, an overview of MEDSIS, a demo for case entry, and then any additional resources. So the Public Health Emergency Declaration was put into place by the governor on June 5th, 2017, in response to the increase in opioid overdoses and deaths in Arizona. The Enhanced Surveillance Directive was released from the governor's office on June 13th, 2017, and the mandatory enhanced surveillance reporting period begins June 15th, 2017. Required reporters for this enhanced surveillance period include healthcare professionals, healthcare facilities, emergency medical services, law enforcement officers, medical examiners, and pharmacies. Healthcare professionals and facilities, as well as medical examiners, are required to report electronically through MEDSIS. The enhanced surveillance also indicates the conditions that need to be reported, including suspected opioid overdoses, suspected opioid deaths, neonatal abstinence syndrome, naloxone doses administered in response to suspected opioid overdose or death, or also naloxone doses dispensed. To get started, we'll first go over how to gain access to the system. You will need to sign and return a user agreement, which is posted up on the ADHS website, and send the signed user agreement to the HSB Help Desk, either by email or fax. Email is helpdesk@siren.az.gov, and fax number is 602-364-3681. Both will need either a subject line or cover page note indicating that it is a request for MEDSIS overdose reporting. So a quick overview about MEDSIS. MEDSIS actually stands for the Medical Electronic Disease Surveillance Intelligence System. It is a centralized system that is housed at ADHS and maintained here as well, and currently used by healthcare facilities and providers to report communicable disease. All 15 counties and 4 tribes for case management and investigations, and we also use the system to share data with our partners, including Sonora and 2 international referral agencies for TB. We've also decided to use MEDSIS for overdose reporting and neonatal abstinence syndrome reporting. It is a secure system, which means that all users are required to sign the user agreement and to obtain a username and password. It is a web-based system, so if you have internet connectivity, you should be able to access it. And it is also a person-based system, which means that when you're creating cases in the system, you are also creating a person record concurrently. So each person record may have a case record underneath or multiple case records underneath. So you are able to see a history of reportable conditions for that specific person. Once you have your username and password, you will first need to log into the Health Services portal. To access that, you'll go to the website indicated on the screen, my.health.azdhs.gov. You may be prompted, especially if you are a first-time user, to install software called Microsoft Forefront. If your institution does not allow installation, you may need to contact your IT, or you can also skip the installation and you will still be able to access MEDSIS. What you'll need to do is actually just click on the Continue button that's on that screen. Once you've logged into the Health Services portal, you are going to be able to gain access into MEDSIS. So you'll have to click on either the MEDSIS training or MEDSIS production icons, and you will be prompted for your username and password again before you access the application. We do have 2 environments. So the first one that I'll go through is actually MEDSIS training, and this is our fake environment, so users are more than welcome to explore and enter in practice cases into this environment. We definitely want to discourage any real patient names and cases into this training site. Our second site is the MEDSIS production environment, and this is where you'll actually enter your real cases and your real reports. Information that you might need before you start entering in cases could include patient basic information like demographics, address, and contact information, and then some specifics about the condition, so the name of the disease or condition, dates such as overdose and diagnosis date, and then for overdose and neonatal abstinence syndrome reporting, we are asking for some additional information as well. So now we'll go ahead and jump into a MEDSIS demonstration. So this is our health services portal, and you'll need to log in with the provided username and password. And from here, you'll see a lot of different, well, you should see a production MEDSIS icon, and also a production or MEDSIS training icon. I have a few more than you'll probably see. But we'll go ahead and go into the MEDSIS training site. And again, you'll use the same username and password as you did for logging into the HSP portal. MEDSIS does open up in a new window, so if you have a pop-up blocker on your screen, then you will need to disable your pop-up blocker. Or you can click to open it up in a new window. So from here, you'll see the MEDSIS homepage, and then two additional cases and reports and extracts options at the top of your screen. For us, we're going to go ahead and start with cases. And on this screen, you'll be able to see any case that was reported from your jurisdiction, from your facility. If you haven't been reporting, you may not see anything here. You can also filter through using this top filter or top search to find any additional cases that may have been reported by your facility. But we'll go ahead and start with entering a new case. So the first step is to click on Enter New Case on the top right-hand corner. This will bring you to a patient search screen, and you are required to input at least one criteria in order to search. And your search is also limited to what has previously been reported from your facility. So you'll see here we have one example case and then two additional cases underneath. If you are entering for an existing patient, you can click on Select here, or you can start with a new patient. We'll go ahead and start with a new patient. So this is our new case entry screen. And from here, we really start separating out between patient information and case detail information. Our person information starts with the basics, including first name and last name. And anything that has a star next to the label or an asterisk is required information. So first name, last name, gender, which can be unknown, and then also date of birth. If date of birth is included, the age at onset is also automatically calculated. Our next section is contact information, which includes both home and work address, if known. The minimum that is required for entry here is the county. If you have the patient address information, we definitely want to encourage entry as well. Okay. Our next section is the next of kin. Again, this is an optional section. So if you have next of kin information, you can go ahead and enter it. If not, you can skip this section. If you are going to add a next of kin record, you'll just click on the Add button to display a data entry form. And again, for next of kin, the only required fields are first and last name. You can also add in additional information such as the relationship and whether or not you have the address. And you click on Save, and once you click on Save, for any of these that have an Add button, like next of kin, and then also later on for the insurance section, once you click on Save, a record will be created in a table, and that will indicate that it has been saved. Our next section is demographics, which again, if you have the information, go ahead and enter it. If not, this can be skipped as well. The options here include occupation, school name, living situation, race, ethnicity, tribal affiliation, and primary language, and also the outcome. If the patient has died, then additional fields will show up as date of death and death certificate number. So if you have that information, you can go ahead and enter that as well. I do want to mention tribal affiliation. This is a field that is based off tribal affiliation only and is not directly connected to the patient's current residence. We scroll up a little bit. The reservation field within the contact section, you can put in the information for reservation here if this patient resides on tribal lands. But if that patient doesn't reside on tribal lands but is affiliated with the tribe, then it can go into the demographic information. So now we start into our case-specific information, including insurance. So insurance, again, is an optional section and does not need to be filled out in order to report a case. If you have the information, then you are more than welcome to enter it here. We'll go ahead and put in an example. And we can start typing in, and if nothing matches with our drop-down options, you can create a new one. And you can put in any additional notes. So now we go into morbidity. And the three morbidities that we're going to focus on for this training are neonatal abstinence syndrome, overdose-related events with fatality, and overdose-related events without fatality. So we'll start with neonatal abstinence syndrome, and you'll want to put in either an onset date or diagnosis date for neonatal abstinence syndrome. We do require at least one date associated with the case. So we'll go ahead and put in today. If you have the medical record number, go ahead and put that in for your facility so that if we need to follow up, we can reference back, as public health can reference back using this number. Our comment section is really an open text field where you can put in any additional information that you might think would be useful for public health to know about. Oftentimes, we've used this field for additional contact information or some other details that are not fitting in any of the other fields that already exist. Sometimes travel information, and those are just a couple of the examples. The labs and observation section is required, and for reporting cases, you do need at least one lab or observation. For the three morbidities for today's webinar, you are only allowed to add a single lab or observation, and it is linked directly to the selected morbidity. So we'll go ahead and click on Add. And from here, you'll see that neonatal abstinence syndrome has been automatically populated for the test performed and test results fields. Those are the only two fields that are required to save an observation. So we'll go ahead and click on Save, and it creates a row in the table, and it means that this observation has been saved. If you want to edit an existing observation, you can click on the edit icon. And then from here, we can go into the additional information that is being collected for these specific conditions. So after starting from type of hospitalization, this is information that is specific for neonatal abstinence syndrome. So things like whether or not confirmatory tests were ordered and what the specimen type was, maternal history, and whether or not, if you have the information, the prescription drugs or non-prescription substances used by the mother. We also have a generalized notes section available as well. So we'll go ahead and cancel this. And you can delete observations as well. And we'll change the morbidity now to an overdose. Change it to overdose-related event without fatality. Here we are asking our reporters to go ahead and put the onset date as the date of overdose. And again, we'll click on Add to create the observation. Now the test performed and test result has been updated to overdose-related events without fatality. And again, we have a mini investigation form starting with clinical presentation. We do have additional information that we are asking our reporters to collect if it's available. But again, these are all optional fields. So if you don't have the information, you are still able to save the record just with the test performed and test result information in the table. So for our next section is attachments, and you are able to drag and drop or click to browse to find your particular file. Oftentimes we have reporters that are including medical records or additional lab reports or additional notes. So this is a great place to put those things. For our medical examiner reporters, we are asking that you upload the PROG reports, P-R-O-G reports, so that we can do some additional follow-up if necessary. Moving on to our provider section, we are able to, we have a database of providers that have already been entered, and if you click on search, you'll be able to associate either existing providers or create a provider if one is not already available. If you are clicking to create a new provider, you can click on, a new provider, or from a new facility, you can click on new provider, and that will allow you to create both a provider and facility. If you are creating a new provider for an existing facility, you can click on one of these options down below, or you can click on one of the existing providers to associate to that case. The reporter information is automatically populated based on your user information, so that's something that you will not need to enter in. So we'll go ahead and click on Continue. And from here, you'll see a preview version of what was entered into the case. So we'll go ahead and scroll down. The case details is actually the information that is entered into that mini investigation form. At this point, you can go ahead and report the case as is, but once it is reported to public health, our healthcare users do not have the functionality to edit cases that have been previously reported. So you definitely want to make sure that you are going through this and making sure all of the information is correct. If you happen to report a case that does need to be updated or edited, you will need to contact your local MEDSIS liaison or the MEDSIS help desk in order to put that change through. We'll go ahead and click back to edit, and that will drop us back into the new case entry form. So we will edit one of the labs and observations and enter in a couple of fields. save this, and again, we'll click on Continue. At this point, some of the information that I just entered will be displayed in the case details. From here, we'll go ahead and click on Report Case. Oh, a little snag. Let's try a different provider. We'll continue and Report Case. Okay, so once you have this pop-up screen, this means that you have successfully created that case, and you have a couple options here. You can enter another case for the same patient if they happen to have another reportable condition. You can enter a case for a different patient, which will pop you back over into that patient search screen. You can view the CDR, or you can return to the cases screen. We'll go ahead and click to return to the cases screen. At this point, you should see the case that you've just entered in this screen. And if you click on either the name of the condition or the name of the person, a pop-up window will show up with the communicable disease report with the additional information, with the same information that was available on the preview screen. So now we'll go back into our slides and talk through a couple of other resources that are available for our healthcare facilities and reporters. So we have a specific user guide for overdose and neonatal abstinence syndrome reporting, which is now available on the ADHS website. We are posting this recorded webinar also onto the website. And all of our materials in general are available for use. Other resources that you may want to contact include our MEDSIS liaisons. Each county and tribe, if they're on MEDSIS, has a MEDSIS liaison. So if you would like to reach out to your local MEDSIS liaison, their information will also be posted on the website. We also have our azhealth.gov/opioid website, and that looks like this. And if you scroll down to the bottom of the page, there is a training tab, and that's where a lot of the resources regarding reporting into MEDSIS will be available. If you have any questions or comments or feedback, we definitely want to hear from you. Our information is on this slide, and our email is medsishelpdesk@siren.az.gov. So we just want to thank everybody for your attention, and definitely let us know if you have any other questions. This concludes the MEDSIS training for healthcare reporters and medical examiners for overdose and neonatal abstinence syndrome.